Hi, you are welcome. We want to continue with the development of the urinary system, and this time around we want to consider the bladder and urethra. I'm Dr. Aidoo with the Department of Anatomy and Cell Biology, School of Medical Sciences, University of Cape Coast. The bladder and urethra are going to form from largely this area in yellow. Where you have the allantoid showing. Now, if you look at it carefully, you see that, let's even go to B. The allantoid has now stretched, okay, into this pouch, which is the urinary bladder. You come and find out that this is actually a urogenital sinus, which will later on become the bladder. So you can again see the bladder. Now you have some urethra going through the phallus, which is eventually going to form the penis in the male. And then that is the urethus. You remember I mentioned the urethus in the other lecture with the development of the kidney. So that is the urethus, which goes through the umbilical cord. It becomes the median umbilical ligament in the adult. There are times it will still persist as the urethus, persistent auricular fistula, and then that can become a problem. If this is successful, the urogenital sinus, which continues with some portions of the cloaca and then the allantoid, will give three parts of the urogenital sinus: a superior part known as the vesical part, a middle part known as the pelvic part, and then an inferior part known as the phallic part. So you can see that at this point the urorectal septum has actually succeeded in dividing the cloaca into two. So that's the superior portion and an inferior portion. You can also see the metanephros, which we looked at not long ago with the ureter. So this region is going to form from the Mesonephric blastema, and this is going to form from the ureteric bud. That's the ureter will form from the ureteric bud. Initially, the mesonephric ducts open above the ureters. So when you look at this, you can see that the mesonephros and the mesonephric duct. That is the ureter and the metanephros. So the mesonephric duct opens above the ureter at this point. However, it will later go below the ureter than above it. So let's see. So at this point, the mesonephric duct is above, ureter is below. This time around, ureter is above, mesonephric duct is below, and these portions of the mesonephric duct are actually being absorbed into the bladder. So once that is formed, you are going to have the trigone. So the trigone is an indication of the inward absorption of the mesonephric duct. So this time around, the ureters are actually above. That's the ureter, and you have the trigone, and the urethra is below. The transitional epithelium lining the urinary bladder will be derived from endoderm, and the question is why? Why endoderm? You should think about it. In the female, the urethra is formed from the lower portion of the urogenital sinus. The female urethra develops endodermal outgrowth into the surrounding mesoderm to form urethral glands and paraurethral glands of skin, which are just like that of the male prostate gland. The transitional epithelium and stratified squamous epithelium lining the female urethra are derived from endoderm. This is what we are talking about for the female. That is the urethra and paraurethral glands of skin. Then you have the lesser and greater vestibular glands. That's the vagina. So the vagina and then the urethra open into a common area known as the vestibule. Okay. So here again you can see the bladder. Then that should be the allantoid, which has now become the urachus, and that is part of the gut. And then that is a gonad. So this region is the nephrogenic cord, and that is the urogenital ridge. Urogenital ridge. So this whole thing, urogenital ridge, that is why you find gonad also embedded in it, and that is ureter. So in the male, you also have the bladder here, and then the prostate will surround the prostatic urethra, which will go down inferiorly to form the membranous urethra. Bear in mind these terms, you will come across them again: prostatic urethra, membranous urethra. We also see that they will have some outgrowths which will form seminal vesicles and then other glands. Then you have the bulbous urethra, and then as you come to the penis, you have the penile urethra. Okay, so note that, which the penile urethra will go through the corpus spongiosum, as you know, and then this will be the navicular fossa, and then the prepuce of the skin will cover it. The prostatic urethra develops endodermal outgrowth into the surrounding mesoderm to form the prostate gland, and the membranous urethra develops endodermal growth into the surrounding mesoderm to form the bulbourethral glands of Cowper. And the bulbous urethra contains the openings of the bulbourethral glands of Cowper. Then the proximal part of the penile urethra develops endodermal outgrowth into the surrounding mesoderm to form urethral glands of Leydig. You have the ejaculatory duct, the prostatic utricle, prostatic outgrowth from the epithelium of the future prostatic urethra. So you have this here, prostatic utricle there. You have prostatic outgrowth from the urethra, and that is the spongy part of the urethra, but obviously you have the membranous part also just below the prostate gland. That is the bladder sitting on top of the prostate gland. So when you look at the prostate gland through a vertical section, you're going to have the glands here and there, and that is the canal through it, which will bear the urethral crest, will also bear the prostatic utricle, and then some openings or ducts of the prostate gland itself. Then you have openings of ejaculatory ducts. This is a fibromuscular stroma with smooth muscles and fibrous connective tissue. There are 3 zones of the prostate gland. I want you to go and look for the names, but it has a resemblance to the architecture of the GIT. Okay, just like the GIT has mucosa, submucosa, and serosa, the prostate gland also has something similar. So make sure you catch that. The urinary bladder, in summary, therefore, will be that it is formed from the upper portion of the urogenital sinus, and the urogenital sinus is continuous with the allantoid. All right, we said the urogenital sinus will have three main parts: a superior one known as the vesical part, a middle one known as the pelvic part, and then an inferior one known as the phallic part. Obviously, this phallic part is what is going to form the phallus or the penis or clitoris. Okay. The allantoid becomes a fibrous cord called the urachus or median umbilical ligament in the adult. So basically, this is how the bladder and the urethra are formed. Our next lecture will be on clinical considerations and congenital anomalies of the renal system. Thank you very much, and I hope this video helps.